Testing, 1, 2, 3. Hello, I'm Dr. Tendler, and this will be the video demonstrating the initial assessment of the patient when they are brought to you by the nurse in the pre-op area. The important things to do are identify the patient, the surgery, the site of surgery, take the medical history, do a brief physical exam, and explain the procedure to assure that the consent is in fact valid. So this is my patient, Lenny Lamper, and he was just brought in. So before any patient contact, we have to have gloves, and before gloves, we have to Purell our hands. Okay? Hello, sir. I'm Dr. Tendler. I'll be giving you the anesthesia today. How are you?
What kind of anesthesia are you giving me?
We'll get to that in 1 minute. I will ask you a bunch of questions first, and then we'll go through your questions.
Yeah, I don't
okay?
like needles.
I know. So, could you tell me your full name?
Jack Smith.
Jack Smith. And what is your date of birth?
July 11, 1946.
And I'm going to check that against your wristband, and that is correct. Thank you, sir. What procedure are you having done today?
I don't know, they told me something with the left eye.
Okay. The consent says you're going to have a cataract removal of your left eye and a lens implant.
Sounds good.
The left eye is the correct eye?
Correct eye.
Okay, do
Left
you
eye,
have
correct
any
eye.
allergies?
Nope.
No allergies. Do you take any medications?
Yes.
What medications do you take?
Atenolol, Flomax, aspirin, Plavix, for now.
And do you know the reason why you take those medications?
Yeah, I had a couple stents put in my heart a few years ago.
Okay. Any problems with your blood pressure?
No, I don't check.
Okay. Any problems with your prostate?
Not since I've taken medicine.
Okay, and you're on the Plavix because of the stent.
I think so.
Excuse me for a second, I'm just going to check your medical record to make sure everything is correct. So now you can check the patient's pre-op medical assessment that was done by their primary care physician and verify any questions that you might have. Also, we'll check the vital signs. The patient will be hooked up, and then we'll do our all-important physical exam. I believe that you do not have to wipe off your stethoscope before contacting the patient. However, there's no harm done in showing your obsessive compulsiveness with cleanliness. Sir, I'm just going to listen to your heart and your lungs. Okay, I heard his heart and his lungs. You could do it for a little bit longer than that. Next, I need to just clean off the stethoscope before putting it on my clean cart.
You have to splice that one out.
Yes. Sir, can you open your mouth and let me see inside? Okay, very good. Could you stick your tongue out gently? Okay, good. And check the distance, the thyromental distance. Okay. Could you extend your head back? That's fine. Now, even though we haven't intubated anyone in about 500,000 procedures, this is a regulation that they want. So the heart, the lungs, and the airway are checked. Next, I would go through the consent, make sure that the consent documents cataract extraction lens implant to the left eye, and that it was signed within 1 month. And then we'd be ready to proceed after discussion with the patients. Do you have any further questions about the anesthesia before we start?
No.
We're ready to proceed. Good?
Okay.